you're putting the pieces of the puzzle together in some ways after these years, which is, you know, something
Yes,
that I think you try and fail or try and succeed, and you start to put together a picture of what may be happening, because for all
right,
these years you're unsure of what is causing this. People could
right.
tell you you're having this pain, you're having this, you could do steroids, you could do, that's great. Those are kind of just masking your symptoms in some ways or exacerbating them in some, as in the case with the steroids there. But you're starting to then realize this is toxicity, this is possibly infection. Where do you go from there? Do you start looking back on kind of your life and things that have happened to try and say, where can this be? Or are you still, you know, just in this state of, I need more data?
Um, of course, I had known a little bit about root canals being a problem. Um, and I did start researching that. I researched other things, you know, my gallbladder and other things that were going on. And that was the one thing that made sense when I took a look at there's plenty of research on root canal treated teeth that they are correlated to heart disease and neuralgias and um, um, autoimmune issues. And so I found a case study of I think it was three women had neuralgia, trigeminal neuralgia, that had resolved after they had treatment, you know, biological dentistry treatment for their root canal teeth and their cavitations. So that really intrigued me, and I said, you know, I think that this is the problem, because I did have some of those other issues that root canal teeth sometimes cause. Now, I didn't think it was my only problem, because I did know that I had a toxicity issue with the mercury fillings. But we know, and a lot of the authors and the people who study these conditions say that multiple toxins make the symptoms worse. If you have people who tend to have a history of mercury amalgam fillings, or say you have some other toxic issue, say you have Lyme disease, which that creates a lot of toxins, or breast implant illness, or biotoxins, you've been chemically exposed in some way, then your symptoms can be worse. And they can, you know, one can make the other worse, depending, because your toxic load, think of it as a bucket that is filling up, and it just gets to where the bucket just overflows. So the body can only handle so many toxins until the symptoms are created. And so I actually, after doing some research, I looked quite a bit on YouTube and watched some doctors that were kind of leading the way at that time. I wasn't on social media at that time. I would look at on the internet and on YouTube, and of course then the research that was available. And I ended up contacting Dr. Stuart Nunley in Marble Falls, Texas. And he is one of the, you know, founding fathers of modern biological dentistry, where, you know, the tooth is removed in the way it needs to be removed for people to be successful. And what's most important is that the tooth is removed, that all the infected material is removed, any soft bone, any infected material, and the periodontal ligament. And you do have some dentists out there, even now, who'll say, I take out the periodontal ligament, but they're not doing a good job of cleaning up the area, and sometimes people will still be sick afterwards. So it's important that, you know, that protocol is followed. And then also, I loved it. Like I said, I had done my research, what was the best way to have this treatment done. And you're probably familiar with the PRF, which is platelet-rich fibrin, which they take your own blood and they spin it out and they make these platelet plugs, and they put those in the surgery sites and they actually stitch them in place, and that brings super healing to those areas. And then the third thing that I felt was very important that they did was intravenous vitamin C. Fairly high dose for dentistry is 25 grams, and they would do that the day of surgery and the next day. And you know, you can see the results. That I'm really happy with how things turned out.